Okay, fantastic. So as Lisa had introduced, I'll talk with you a little bit today about OIE communication materials for AMR and really looking at communicating effectively within the animal health sector. I know in specific countries you may be working on a One Health approach, but I'll focus specifically on animal health sector, and as well as what's available at the global and regional level. Okay, and to get us started, I'll start with the global campaign from the OIE, which we call the We Need You Communication Campaign. Hopefully it's something that most have seen.
Sorry, Taylor, could I just interrupt? We're seeing your notes screen. I don't know if you can maybe move the screen that you've got. It's obviously playing, but we've got the...
Let's see.
If you have it on one of your monitors, maybe move it to the other one.
Let's give it a try. It is, we shift it up here. Does this change how you see the presentation?
That's still the same, sorry. Maybe we can still see it okay, so we'll continue.
On the top you have display settings.
Yep.
There you can choose how to display the presentation.
Swap presentation view? No.
Or duplicate slideshow probably.
Okay. Like this? Does that work?
Perfect.
Okay.
Thank you. Thanks,
okay.
Paula.
Yes, I have no notes now, so let's hope this goes okay. But I think that'll be fine. Okay, great. So the We Need You campaign was developed as part of a toolkit and to support member countries and align with the OIE strategy on AMR. And so as part of the OIE strategy, there are 4 objectives, and the We Need You campaign targets 3 of those. And so the 3 are improve awareness and understanding in the animal health sector on AMU and AMR, to support governance and capacity building at the veterinary services level, and of course to encourage the implementation of international standards. So the campaign itself targets 8 stakeholder groups, and those include policymakers, farmers, veterinary students, wholesale and retail distributors, veterinary services, pharmaceutical industry, animal feed manufacturers, and veterinarians. And these 8 stakeholder groups were developed are determined in a collaborative way through an annual AMR assessment that we do with our delegates and stakeholders. And so the communication toolkit includes a variety of different resources dedicated to the different 8 stakeholder groups. These include posters, different stakeholder leaflets, campaign videos, social media squares and GIFs, website and email banners, media engagement, graphics for goodies, and a campaign website. And the campaign website at oie-antimicrobial.com is where you can find all of the tools in a repository. And so hopefully these are resources that you've seen before. I think the animals are starting to have increased visibility within the community. And so just as an example of how to reach the repository, online you can see at the top of the bar there, typing in the website address, oie-antimicrobial.com. And then from there, on the homepage, you'll see information about the objective of the campaign, that we all have a role to play to fight antimicrobial resistance. You'll also find the 8 stakeholder groups that you can select to find out more information, as well as a survey to test your knowledge. So animal health professional and farmers. So the animal health professionals is going to be a bit more technical, where the farmers is more for general public. And then on the left-hand side of the screen, you'll find the menu, and that's where you can select from the different stakeholders. So for the sake of this meeting, I'll select veterinary services. And then from there, you'll see the dedicated button to download all of the tools, and that will take you to the repository. And from there, you can select which tools you'd like, and it allows you to download. And so this is available now, it's available year round. And an important piece of this campaign is that it's not specifically for an event. It's not for World Antimicrobial Awareness Week. It can be used year round. And so we encourage you to visit it at any time when you have a communication opportunity around AMR to either use tools or to be inspired to pull key messages. So from a more practical perspective today, I wanted to spend a few minutes talking about different steps you can take in the communication planning step. And so for the sake of today's meeting, and that we have a big communication opportunity coming up, I'm going to focus on World Antimicrobial Awareness Week. And so I've prepared an example timeline of the events that you could be planning throughout the couple months leading up to WAAW. And since WAAW is a slightly larger event, it may be an event in which you are planning a few months in advance. And so this schedule starts in July, where you're identifying your stakeholders and the outcomes. And so the stakeholders are going to be the audiences that you want to communicate to. And the outcomes are the things you want to achieve with your communication. So what do you want? What's the change that you want to see in your audience? Moving to the next month, you may be working into assessing your budget and resources. And so resources can be both financial as well as human resources. Do you have the individuals available to you to help prepare for this event? And then for September, we're working into designing stakeholder messages and selecting communication opportunities. And so WAAW itself is a large communication opportunity, but there are also different world days. For example, you have World Children's Day that happens on Friday, the 20th of November. And so there are different opportunities in which you may want to target your messages to specific days. And so for the sake of today, I'll talk a little bit more about what's happening in September. We're designing our stakeholder messages. Okay, so as an example, and just to briefly break down this process, I've just included a few simple steps. And so the first one is the SOCO, and the single overarching communication outcome. And you can learn more about the SOCO as well as audience analysis and this slide in the OIE Communication Handbook, which is available online. So just a plug for that, but I'll talk more about these points today. And so for your SOCO or your outcome that you want to achieve, looking to develop something that's clear, it's understandable. Do they understand the language that I'm using and the way that I'm talking about my issue, as well as an outcome that's realistic and achievable. And so sometimes it's okay to break it down into several SOCOs, several outcomes that you want to achieve. The next step is you want to consider your audience, and these are the targeted stakeholder groups that you want to speak to through your communication. And so you want to ensure that or understand how knowledgeable about the topic is your stakeholder group. Do they care about this issue? Do they need to learn some basic information about the issue before we can get them to change their behavior? And to also analyze the level of interest and energy that they've invested into this topic. And that will help you to adjust your messages appropriately to get them to that next step. And then the final step is to develop the messages that you want to communicate to your audience. It's great if they're action-oriented. Give them something to do, something to achieve, as well as something that speaks directly to the audience. And so that could be, directly saying, veterinarians, we need you to do X, Y, Z. So speaking directly to them instead of speaking about them. So as an example, on different ways that you can create these messages, your outcome is that you want the public to stop buying and using antibiotics without a veterinary prescription, and with supervision. I'll make that correction and make sure that that slide is sent to everyone. Your audience for this is general public. And the message that you create is that use antibiotics responsibly, a general message that can be used for all general public. But more specifically, you'd also develop a message, only use antibiotics after consulting your veterinarian for prescription. And so the second example is that farmers follow exact dosing instructions when treating livestock with antimicrobials. So for this, your audience is farmers, so a bit more specific into the individuals. And farmers can include small-scale farmers, backyard farms, as well as large-scale production. And so you may want to divide your audience into those groups and have different messages for those groups. For today, I just have the messages for farmers in general. And so your messages could be follow the length of treatment and withdrawal period as prescribed by your veterinarian. And the second one, to only use the prescribed dosage of antimicrobials. Fantastic. So incorporated as well into your scheduling, I think it's important to note the translation of documents. And this process may take anywhere from 1 to a few weeks. And some of the benefits of translation of your documents is that you're able to improve the accessibility and the understanding of your messages to your stakeholder groups. This is important because occasionally when your stakeholder groups translating the messages from maybe a more common language into their local language, there could be misunderstandings and misinterpretations. And then those inaccurate messages continue to be shared amongst the community. So making sure that the messages are translated so that they're well understood is actually quite important. It also helps you to build rapport with your audience. They appreciate and they respect the fact that these messages are made in a very accessible way. It helps to portray the original tone and urgency of the message. If you want to ensure that your message is not only understood in the terms of the technical aspects, but also in the emotions that you want your audience to feel, translating that can help improve that, as well as that the messages are shared in your audience's primary language. And so if they're speaking about this based on how you've communicated the information amongst their community, how they share this information with their peers, it's really important to meet them at that local language. And for the Asia region, the regional office does have a number of the AMR tools for the We Need You campaign translated into local languages. And this is a collaborative effort that has been worked on with the regional office, with the country representatives, sometimes with the HQ. We all kind of work collaboratively in this process. And the languages that are available are on the regional website, which you can see down in the right-hand corner, rr-asia.oie.int. And just a quick snapshot of the website itself. And you can see we start with a few of the languages in alphabetical order, but many languages available. We encourage you to check those out. So some of the different examples that we have for activities that have happened in the past. We have an awards for AMR awareness activities. We have a video to promote AMR messages, visible community messages in AMR, and then a social media account and community. And some of these are in-person events. So the challenge is to consider how can you continue something similar. For example, the awards for AMR activities. I believe this happened in Japan last year during World Antimicrobial Awareness Week. I don't have my notes, but I think it's a great example to share the creative approaches to communicating on AMR. So how can this be done in a more virtual way if a meeting isn't available anymore? Is it a webinar? Is it a website where people can submit material to share? Is it a repository where people can access material to use or get inspiration? Additional community messaging, how can this be done in a way that the messaging is visible to the community in a way that they receive information effectively, but also safely considering the current situation. Video messages can be promoted through all kinds of digital avenues, through email, through social media, on websites. So the opportunity is more broad for videos, which I think are also a great opportunity to share information, to promote what the veterinary service is doing, etc. Okay, so specifically, of course, I've mentioned World Antimicrobial Awareness Week a couple of times, but I'll just briefly mention a few points on that. I think what's important to note this year is that we have moved to antimicrobials instead of antibiotics. So we're expanding to prioritize the broad range of all antimicrobials during this week. And so we have our initial objectives. And so we're looking to make antimicrobial resistance globally recognized. We still want to increase that visibility and to maintain that visibility if that visibility has already been reached. We want to raise awareness. We want to increase the recognition of the roles that individuals have to play in all sectors. And we want to encourage behavior change and convey the message that simple actions can make a large difference when done on a large scale. And so with the shift this year, we will also be expanding and sharing a new logo, which will be Handle Antimicrobials with Care. And additionally, in the regional Asia region, there was a video that was produced last year and at the beginning of 2020, and it's a regional AMR video with a One Health approach. And this video, quick snapshot of it, but it was developed in collaboration with FAO, WHO offices, and UN environment within the Asia regional. Okay, great, thank you. I hope I haven't missed anything, but I'll share the presentation, which can mention any notes that I may have forgotten.
Thank you very much, Taylor. That's great. If you could just stop sharing your screen, wonderful. So next we're going to move on to some presentations from the region. So we'll start with Nepal. Dr. Banshi Sharma, if you're ready. I think we're going to show the presentation from here. So if you could just let us know when to move to the next slide. I think you need to unmute. Let me just. There we go. Yes, okay. Wonderful. Thank you.
Thank you. Respected regional representative, WAAW delegates, ladies and gentlemen. I'm going to present you 2019 World Antimicrobial Awareness Week activities in Nepal. Next. Last year, what we did, just we have written some of the major component which we did last year. Deployment of AMR awareness material in Nepalese language using WAAW templates. I'll show you how it looks like in next slide. An AMR database sharing program with veterinary practitioner, multi-sectoral meeting with involvement from human, animal, food and environment sectors. And we have a very special one, joint message from high level on AMR awareness. This is for the first time in Nepal. Our Honorable Prime Minister, our sectoral Minister of Health, Animal Health and Environment, they all in one day we make it, and the joint message gone through the country in different media. Next. And the activities conducted, there is important activities that AMR awareness material in Nepalese language. And you can see here showing the same templates of the Nepalese, and we have a rigorous exercise on it, and we do have taken the help of the academicians, researchers, expert and everybody, so that our message should not go beyond the WAAW guidelines. And it is very popular, and we have distributed the one in 753 municipality of our country. It was done in November 2019, and the Department of Livestock is the major contributor apart from the WAAW, and we have printed it and we have distributed it throughout the country. Next. AMR data sharing program also we have conducted on November 23, and there is a 50 participant from the different organization apart from the TLS, and there is also support from the FAO ICTADS and the private veterinarians, and we do have a fundings from the Fleming Fund, Nepal. Next. We do have a multi-sectoral meeting with involvement from human, animal, food, and environment sector, and there is 100 participants from human, animal, food, environment, and Ministry of Health and Ministry of Agriculture and Livestock Development officials. Thank you. Next. And there is a joint message from high-level political leadership on AMR awareness issue. This is on 24th November 2019. Our Honorable Prime Minister and 3 sectoral ministers jointly, there is a press release, and it is distributed in all of the TV, radio, and all of the national news. But it's a very interesting, and it is for the first time in Nepal, it is happened on antimicrobial use, and this is quite important. And there is others different AMR awareness program, interviews in mass media, workshop has been happened. Next. Photo gallery of the activity of awareness material. These are the message which we got from the WAAW, and we make it in Nepalese language by thoroughly and rigorously incorporate each and every points over here with series of meetings we have conducted, and I have lead these all meetings so that there is no confusion to the public, and it is going to the mass right now. Next. This is also the photo gallery. Next. Next, continue. This is the message from the Prime Minister and other message from the ministers, 3 ministers, and it has gone to the public. Next. I would like to a little bit more give time on this one. Actually, we do have a meeting at Department of Livestock Services to organization Antimicrobial Awareness Week 2019 as usual. And in this timeline, we have prepared. The major thing is the translation of WAAW materials, leaflet printing, joint meeting with human health counterparts, FAO, WHO, and Fleming Funds. And we have a meeting, one meeting in the Central Veterinary Laboratory in Kathmandu, and another meeting also the Ministry of Health and Population, because we have taken care of each part, you know, more person from the human health in one meeting and more person of the veterinary science in another meeting. So we have organized accordingly, and there is we have a little bit support from the Fleming part to also implement this one, and we have a very grand success of this one in 18 to 24th of November last year. We did a lot of work on that period. Next. Actually, the work for all was the biggest challenge, as we all know. For example, multi-sectoral stakeholder programs are planned to organize during the start of antimicrobial week. However, it has to be shifted and finally conduct the last day of the awareness week. This is one. In early years, used to organize morning rallies, distribution of T-shirts, caps, etc., which we found was of limited use in rising mass awareness. Therefore, in 2019, we focused on developing mass media-based awareness material. Poster from WAAW translated in Nepali is one of the major and important activity, and it has a good impact also. Multi-sectoral planning meeting with human counterparts, UN agency and funding agencies such as Fleming Fund help us to identify resources available and conduct program without duplication. And Nepalese, our own government of Nepal resources also we have utilized for this one. Thank you. Thank you. Thank you very much.
Thank you very much indeed for your presentation, Dr. Sharma. So as I said, if you have any questions or comments, and if you could just put those in the chat box for Dr. Sharma, and we'll move on to our next presentation.
So we can go directly to slide number 2. This is the tables of our activities conducted last year, 2019. So actually we divided at 10 main activities. First is a live radio campaign. So we use a national radio station, which already held on 18 November 2019 in Jakarta. And the second one, we launched the AMR information, education, and communication materials, and a video blog contest, which already held on 19 November 2019 in Bogor. And the third one, the farmer seminar, which is held on 21st November 2019 in Lampung. So we can go to the slide, next slide, slide number 3. And also we have a media briefing, which held on 21st of November 2019 in Lampung. And also we already done the street campaign, which is held on 22nd November 2019 in Lampung. And also the community contest with surfing disease, kid coloring, eat boiled egg, which is held on 22nd November 2019 in Lampung. Next slide, please. So other activities are media visit, which held on 22nd November 2019 in Lampung, and talk show for students, which held on 23rd November 2019 in Lampung, and student contest, which they are doing the oration or presentation, which has on 23rd November 2019 in Lampung. And the last is talk show for community held on 21st November 2019 in Lampung. In general, the FAO and USAID, the Directorate General of Livestock and Animal Health Services, and private sector have allocated budget for supporting the World Antibiotic Awareness Week 2019 celebration. Next slide, please, number 5. Yeah. This is the slide explaining the OAI support, which we already received support for printing of translated information, education, and communication materials. They are all 5,000 copies, and the contents, the veterinarian leaflet, wholesaler and retailer leaflet, and animal feed manufacturer leaflet, and leaflet for farmers. So we already print and distribute it to the target, and also including for farmers. This is the photo of our translated materials. And next slide, please, number 6. So this is the pictures, the photos of the live radio campaigns they already done in 18 November 2019. We are using the national radio station, with can cover all the national area, but the stations located in Jakarta, or in the capital city. Next slide, please. So this is the pictures launch the AMR information, education, and communication material, with the key message that antibiotics are not recommended for poultry disease prevention, to avoid misuse of antimicrobial in the field. So means that antibiotic only used for the treatment, not for the prevention. Next slide, please. Yeah, in this slide, we show that the OIE poster that we show to the farmer and stakeholder during the launch of the AMR information, education, and communication materials. So we involve the farmers also. Next slide, please. Yeah. These pictures also show our activities when we are doing the meeting with the farmers, particularly mostly the farmers related with the poultry farmers. So in this opportunity that we already socializing the reducing antibiotic use through the strengthening 3-zone biosecurity. Means that when the farmer they are implementing the biosecurity, good biosecurity, so can reduce the risk of infection, which should be treatment by the antibiotics. And next slide, please. So this is the media briefing with the local and national mass media. So we think that the media have a very important role on disseminating the knowledge related with the antimicrobial resistance. So this we conducted in Bandar Lampung, Sumatra province, and the focus topic is the impact of imprudent use of antibiotics in animals on human health and antibiotic residues in animal. So we hope that the media also help us to support us to disseminating knowledge related with the preventing AMRs. Next slide, please. So this is the media visit to poultry farmer with national mass media. So we invited all the media, and we bring them to see directly the situation in farm, particularly the poultry farmer, so they can understand what is the situation, and they can make the descriptions for article for the people through the media. Next slide, please. This is the street campaign. So when we have a carnival celebrating on day that the people they are going to the street, make celebrations. So we doing the campaign for the community engagement. So we invited all the people to give the contribution on disseminating the knowledge related with the AMR, the antimicrobial resistance. We have done this here in Lampung at the time. And next slide, please. So this is the talk show. So the activities has done in university campus. We invited the students in university. Then we have a thema on the role of Civitas Academica in control of antimicrobial resistance. So all the students, particularly the student of the Faculty of Veterinary Medicine, they have knowledge through our campaign, through seminar and talk show. Next slide, please. This slide, I would like to share that according to our experience, that for preparing the campaigns or the socialization, so we need quite a time for preparations. For example, we starting for activities on 2019, starting on January to July, for developing the TOR, meeting with partners to discuss and to develop what kind of information, education, and communication material that we will present at the events. And starting on August to October 2019, so we finalized the TOR and to print the material, and also the preparation, final preparation for meeting and contents announcement. So we hope that we will start on November, so the information already distributed to the target. And on November 18 to 24, so this is the time for conducting the awareness campaigns. Next slide, please. There is a top tips that as standard template from OIE. So we would like to present that we have challenges on encountering during the World Antimicrobial World Antibiotics Awareness Preparation. Sorry, yeah. First, we have a challenge on obtain the support from local government and the private sector, particularly in Lampung, Surabaya City, for the events. Since we have to make sure that our information could reach the decision maker in the local government, since that we already have decentralization. And how to overcome the challenge? First, we doing the strong coordination and communication to all the partners. So the communication could be directly to the decision maker, but also could be indirectly through many partners. So their partner could also send the information or to convince, yeah. And the other strategy, use event of certificate award ceremony to add layer farms that could implemented the sanitation standard by Lampung governments. This encourage them to have appreciation that they are already doing the right way. And also to use the event of Muri, this is the Indonesian record, yeah, for the prestations ceremony for Lampung, for the 14 poultry farms that obtain number control of veterinary standard certification in the year 2019. This is the veterinary control number as part of the technical criteria for implementing also sanitation and hygiene, which is related with the biosecurity to reduce the infection, risk of infection. Next slide, please. And what lesson learned that AMR communication shared to colleagues in the regions. So with the AMR communication effectively share via or through social media. This is the most that we have an experience on sharing the AMR communications. And the second one, through the mass media, both national and local media. So the people could have many information through the mass media, and also through the farmer associations. So mostly Indonesia, because the smallholder farm, so we try to make a communication through farmer association is quite effective, also through farmer association. Next slide, please. Yeah, that's all of our experience. What we already done for the World Antibiotic Awareness Week in 2019. So we hope this give the information what we already done, and hopefully for the next opportunity, so we could have many input or suggestion to make more better for the future. Thank you very much once again.
Thank you very much indeed for your presentation. You certainly conducted many activities and reached many stakeholders last year. So we wish you success this year as well. So we are going to try to go back to Mongolia now. So we'll share the presentation from here, and then hopefully we can get sound from Mongolia. So if you just give us a second to get the presentation up.
Hello, can you hear me?
Yes, very clearly. Thank you. Go ahead.
Thank you. Good afternoon, everyone. We are attending from Mongolia, and the World Antibiotics Awareness Week activities in Mongolia. We are celebrated in 2019, our first time in our country. So today, Dr. Kantumur, our focal point for animal production, is attending together with me. And I am the focal point for communication in Mongolia. Thank you. Next slide, please. So, World Antibiotics Awareness Week is conducted in November of 2019 in Mongolia, and we had a letter of agreement between the WAAW regional representation and the General Authority for Veterinary Services, and we received the financial support from Fleming Fund on the leaflets, print and distribution. Next slide, please. So the leaflets, why we need leaflets for the farmers. We have chosen 3 leaflets, and we printed 1,000 sheets for each leaflet. And in the next slide, we also translated and printed the WAAW antimicrobial use leaflet for veterinary service too, and also we have translated and distributed the 3-per-sheet leaflet from FAO and WHO. And on distribution of leaflets, we gathered the different from the different provinces of Mongolia, and the totally 17 participants came from the different 17 provinces, and they attended to the distribution of the We Need You leaflets to every destinations of Mongolia. And next, and also policy makers also included on the attended on the distribution of the leaflets. It was from the ministries of Mongolia and the international organizations and the Central Veterinary Laboratory and Central Drug Quality Control Laboratory, and the research institutions also included. And also we invited to conduct the distributions of the leaflets from the veterinary drug distributors, the drug pharmacies and drug distributors. And FAO and WHO organized a multi-sectoral conference, and we, from our side, the 50 participants attended from veterinary field, and we of all fields of the veterinary states, the policy makers and drug suppliers and researchers, and also local veterinary officers attended the multi-sectoral conference. And we, General Authority for Veterinary Service, organized the veterinary workshop on AMR. It was organized in our State Central Veterinary Laboratory, and we recently developed the veterinary drug residue national control drug residue control plan. It was approved from the ministry in the last year, and we have introduced the new control plan to the local veterinary drug control inspectors. So the timing was a bit tight last year because we organized it our first time. So only 1 week before the World Antibiotics Awareness Week, we had the agreement from between the WAAW and Mongolian Veterinary Organization, and we translated and printed the distribution leaflets only for the 1 week, and it has been distributed and on time, just in World Antibiotics Awareness Week. Also, we have translated the 3-part sheet, One Health video to Mongolian language, and we was planning to broadcast it in Mongolian National Broadcasting TV, but because of the tight schedule, we didn't. It was not. It was delayed because of the tight schedule. So thank you for your attention.
Thank you very much indeed. That was a nice, clear presentation. I'm glad we got your sound back. So I noticed that we're running a little bit behind time. I'm very sorry for that. Just if you have to go now, we will be putting all the presentations onto the regional website, so you can watch them at a later date if you need to. But we'd be very happy if you can stay with us, because we still have one more presentation, and I think this will maybe be a very useful one as people are planning for World Antimicrobial Awareness Week in these times where the internet is king. So I'd like to invite Paula Pinet from headquarters in Paris to make her presentation. Thank you, Paula.
Thank you.
Thank you, Lisa. Hello, everyone. Good afternoon to you. I think I'm going to share my screen with the presentation. Here it is. Okay, so I'll try to be brief. I think, do you see it okay, or do you see the notes?
We're seeing the notes.
Yeah, I thought so. Now I click on something and I don't know what's going on. Okay, is it okay now?
That's perfect, thank you.
Perfect. Okay, great. Well, I am Digital Communication Officer here at headquarters. And so today, one of my main responsibilities is the social media of WAAW. I have been working in social media since I started working ever. So I'm very passionate about this, and so I'm very happy to be with you today to talk about this important topic. Today, social media has taken a very, very important role in any communication, even in our daily lives. So today we will talk about how to target your audience to have an impactful campaign and impactful communication through digital channels, so through social media. So before we go to talk about how to do it in social media, first we need to understand what is going on in the social media world. So let's do it together. I prepared some slides with some interesting numbers. So today we are almost 8 billion people all around the world, and from that 8 billion people, we have a little bit more than half of them using social media. So 3.96 billion people are using social media today, with a 51% of penetration, which is something very, very important. It's a really high number, so it's something that you need to take into account and understand in order to use this tool in the correct way to pass your messages. Next. There you go. So how is social media being used around the world? So well, from these 3.96 billion users, we see that 99% are using it through their mobile phones. So this is very important to know, because today almost everyone has a mobile phone, a smartphone with their social media, with their WhatsApp or WeChat or Facebook or any other social media platforms that are being used in the country. And so it's very important to know that it's being used through a phone, and so that, because it means that people have direct access to it. They are spending time using their phone. I think in the next we will see how much time they're using. So they're spending 2 hours of their day in social media in an average. This is all around the world. And so it's quite interesting also to know how people is not only seeing social media, or not only looking at posts, but interacting, contributing to this social media environment, commenting on posts, creating their own environment. Today now with TikTok, people have this capacity that's been growing with TikTok, Instagram, that they have been growing a lot in terms of, I can do my own videos, and I can do a video very easily by just clicking on my phone and share it with billions of people. So people today are also contributing. So it's very important that you understand that social media is not only a one-way channel, it's a several ways channel. So you are having a conversation, is talking in social media and through social media, it's the same way as having a conversation in a group. Like you are at your home, you invited your friends, you're having a conversation with them, and you will be talking maybe with one, then two, then four, then one again. It's the same thing in social media, but you will be having a reciprocity, and you will be connecting with people at the same level. So what are the most used platforms in the world on social media? Facebook is still #1. They are still winning the battle of social media. However, we have YouTube and WhatsApp that are coming behind very strongly. So what this is telling us is that Facebook has been the channel, it's like the traditional channel. Everyone has Facebook, and it has become something, a part of your life. If you want to talk to someone, you know they have Facebook. YouTube and WhatsApp, the particularity is that first of all, the video content engage very much with people. It's easier to transmit an idea through a video than through an image or through a text, because the video is something that I see, I understand, and I don't need to read, I don't need to pay attention fully when I watch a video, as I need to pay my full attention when I read something to understand or to watch an image. But the video, I can do two things at the same time. So, so this particularity of video has helped YouTube win or be on the top. And then WhatsApp, which started as sharing messages, having the accessibility of sharing a message with my friend that's living in the other side of the world, has been very impactful in the way we're using social media today. Of course, then we have several others. We have WeChat that is starting to gain a lot, and mostly in Asia, in China, it's being used a lot. Instagram, that's also winning, in TikTok, that is starting to pull up and grow in the use of social media platforms. So beware of TikTok. I think it's now in the conversation of everyone. So if you want to try it, feel free. I think it's an interesting exercise to start using TikTok, mostly to reach these young generations. Well, it started with young generations. I think that thank you to COVID, and we will see that before, thanks to COVID, the use of social media has changed drastically. But before going there, here you have a comparative table telling us that actually not because I have Facebook, that's the only thing I will use as social media. This is a multi-cross platforms. I can have several channels of social media that I use at the same time in a regular basis. So it's important to know and to understand what channels are being used in your countries. in order to talk to your communities and to talk to your public in the different channels, not just in one. Be aware that having one can limit a lot the conversation, because probably even though everyone is on Facebook, maybe I spend more time on Instagram. And so if I communicate in Facebook and Instagram, I have more chance, double chance that people, the same person, to look at my message. Okay, so that increases the chances of visibility and reach. Reach meaning how many people is looking at your content in social media. Okay, so finally, as I was telling you, COVID changed a lot the use of social media. As I was telling the example of TikTok, TikTok started as a video blog that young people were using just to communicate among each other. Young people meaning people of 16, 17, 18 years old, teenagers that were even 14, teenagers that already had a phone, that started using their phone, and it was a platform where mom and dad were not there because well, they are in Facebook. It's more certain that they are in Facebook. So TikTok became this platform. But after COVID, TikTok started being used by millennials like me. I started looking at TikTok and looking further into it. We had more time, more free time in our hands due to the confinements, due to the lowest of activities. So what do? You spend time in social media. And so you see that social media is beneficial. And at some point, if I have the idea of social media is just to waste my time, people started seeing some benefits of using social media and passing messages through social media. So today the use has increased a lot. Today we have more people using social media than not using social media. Okay, so the numbers are starting to turn around, and I hope that at some point everyone is using this important tool. And so here we see how it has increased, how the use of social media has increased thanks to the COVID. And so all of these numbers are very interesting, and understanding them can help us to avoid these kind of questions, like, I want something to go viral. Okay, what do you want to go viral? Well, I want my strategic framework for engaging stakeholders. So as we see, we have everyone in social media. With these numbers that I just showed you, we saw that everyone's on social media. And the most important thing that I told you is that people are using it to have a conversation. And whenever you have a conversation with a friend, do you talk to them like that? Like, oh, I just did my strategic framework for engaging stakeholders. I think you never use this kind of words when you're talking to a friend. You use them probably under a work environment, but not where you're trying to engage and have a conversation and make people understand you. So understanding these numbers helps you, but then you need also to know what you want to achieve with your communication. And learning this would avoid you to have the incorrect message with the incorrect wording. And so now we're going to discuss about what the OAE done during World Antibiotic Awareness Week in 2019, based on the communication campaign, the We Need You communication campaign. So just to let you know, the OAE has these different social media channels. Please follow them, like them, comment them. We have Facebook, Twitter, LinkedIn, YouTube, and we hope that soon we can expand and have even more channels to reach more people around the world. So in 2019, what did we wanted to achieve during World Antibiotic Awareness Week? We wanted to reach our social media community with the targeted messages that we had created in the campaign that Taylor explained very well in the first part of this webinar. To let them so we targeted messages on the prudent use and responsible use of antimicrobials among the different stakeholders. So we wanted them, as Taylor said, to understand and just to use antimicrobials responsibly and prudently. We needed to communicate that and to achieve this, okay, so that people understood these messages. So what did we do? First of all, we used and we based ourselves on this video that I will show you. I'm not sure, I don't know if everyone has seen it. If you haven't, well, this is your opportunity to see the video. It's a video that we created on the campaign to disseminate through social media and other channels. So here you go. I hope it plays correctly. Okay, great. So based on this video, now let me see how I get out of the video. There you go. So yes. So based on this video and all the campaign, the communication campaign that the OAE has created, we started posting different messages during World Antibiotic Awareness Week. So first of all, we needed to know who are we talking to on social media. Are we talking to veterinarians? Are we talking to what kind of stakeholder are we talking to? Through what channel? Through Facebook, Twitter, YouTube, Instagram, LinkedIn. Who is in these channels and how do we need to talk to them? We have so many stakeholders that we needed to identify. And so we did a little work on understanding our community. How do you understand your community? You will look at what are they posting, okay? So just look at the followers that you have, the people that's following you. What are they talking about? What are they posting? Who is reacting? So you need to be a bit of a stalker when you are a community manager, when you are managing social media. You need to go and see whoever comments in one of your posts, you go and see their profile. Who are they? What are their interests? There are many tools that help you as well understand this. There are monitoring tools. There are tools that will help you understand who your community is. Facebook and Twitter insights, or Facebook and Twitter, they have these insight tools for free that can help you also have an idea of who your community is, where they are living. So based on this, we did an analysis and we understood that in Facebook, we found that we had our veterinary students. They use Facebook very much. We even created a community of students in Facebook. We link in with the IVSA, which is the International Veterinary Students Association. We work with them very closely. We realized that they're using Facebook to share their messages. So we use Facebook to talk to them. And what we did is that we're talking to them directly. We are having a conversation with veterinary students. So here you see in the post is veterinary students, you could have to face and ensure future due to antimicrobial resistance. So we linked to the problematic. We added value to the role. We told them that it's important that they act and they react to use prudently and responsibly antimicrobials. And then we gave them a solution. We gave them a series of images that they could share among their own community in order to understand why is it necessary to use antimicrobials prudently and responsibly. Then we did Twitter. In Twitter, we know that we have industries are there, are journalists that can also have an indirect impact with the industries by generating probably an article talking about the industry, which is something that's happening a lot. We have ONGs that are in Twitter following us and moving around this social media channel. And so we did the same thing. We added value. In here, we wanted to talk to the pharmaceutical industry directly, and we talk to our journalists and ONGs indirectly. So we are adding value as well to their role by saying that they are the gatekeepers. So they need to understand that it's them who need to contribute to tackling AMR. So they are contributing, and they have a very important role on the fight against antimicrobials. And we gave them, in this case, if you see in the case of Facebook, we were having a more light conversation. And here, this is more rational. We have more facts. It's a little bit more, the way we're talking to them is less relaxed, and it's a little bit more strong. We ask them to act. We give them, and we ask them in an indirect way to act. And we show to the whole community of Twitter, not only to them, but to the whole community, what is the importance of the pharmaceutical industry. Next, through LinkedIn, we realized that here in LinkedIn, we have our experts, okay? Why? Because LinkedIn is a very professional social media. It's a channel where I am sharing my work, what I do, what's my expertise, as because I have my old resume, my CV is in LinkedIn. And so here we're talking a very rational language. Here we have facts, we have numbers, we have resources. So as you see, we'd add a link to more information about actions and how to tackle AMR. And in here, we are not tackling a specific stakeholder, but we're more talking about numbers and facts in general about AMR. And we are also sharing the expertise that the OIE has on this issue. Okay, so as you see, the interesting thing here is that we are talking to our community as they talk. We are trying to understand them so that they understand us, okay? In addition, one of the tactics that we have used, and it's been very interesting, and we're trying to replicate it now that World Rabies Day is coming, is to make them participate also. It's not only the OIE who's talking. As I told you in the beginning, we're having a two-way conversation. So it's not only the OIE who's telling you what to do in order to tackle. So it's also you telling us, how do you do it? What are you doing? So we find the solution to do this through polls. Today, most of the social media channels allow you to do a poll. And so we ask the community, so participate. How do you use antimicrobials with care? Let us know. And also this help us to see how our community is acting, not only in the conversation, but in the real world, in the real action, okay? So as you see, we only with vet prescription. We're only using them with vet prescription. So we see here that at least one of our messages has reached people. They have 59% of our community is using antimicrobials only by vet prescription, which is one of the main messages of the OIE, the AMR campaign. So this, at least we know that it's working, and what we're communicating, it's working. In addition, we created a test for students, and so they could also prove their knowledge. I think students like to prove their knowledge and to know that what they're learning, it's still in their brains and they haven't lost it because they are hangover. And so this is another way that we are trying to make the community part of the discussion and not just have the discussion on the OIE side. And finally, we're trying to create also interactive ways. So we created these frames that people can use to show how they use. I use antimicrobial resistance. I am responsible in the use of antimicrobials, and I use them prudently. And so we created these frames that are accessible through Facebook so that people can use them, take photos, and show and keep growing the conversation on social media. And so all of these actions are very nice, are very good, but do we really achieve what we wanted? How can we know that we really achieve through the World Antibiotic Awareness Week what we wanted, which was to disseminate and to reach more people to understand how to use antimicrobials? So here is the part where you need to analyze your campaign. For us, it was important that people share the message and understand. So we did a little, we became once again stalkers, and we tried to see our community if they were using the messages. And so we realized that they were actually using them, and that they were translating it, and not just translating them, but probably sharing them on their own social media channels. So Nigeria Center for Disease Control, and they were using the same messages that we were repeating over and over. The same here in these other posts from Nigeria as well, how they are sharing, taking photos and being proud of sharing the messages sometimes of antimicrobial resistance. The IVSA helping us, pushing the campaign, people using the frames that we created, and not just one, but all of them. There's only, this person is using even 2 frames to show the messages. We even had the Australian Veterinary Association sharing the video on social media. I'm sorry. And so this is the way we know that our campaign is working and that their communication is working, that what we're saying through social media is being understood. There are other ways as well to talk about indicators. You can also have more precise numbers, know how much people share your post, how much people like it, how much people commented on it. But in this case, I wanted to show you that the important thing is that people are using and replicating your messages through their own channels, so that the conversation is larger than only you, okay? The conversation becomes a worldwide conversation. Thank you very much. I hope this presentation was of any use. Feel free, I didn't put my contact information, I think I forgot, but please feel free to contact me through, well, I think Les, I can give you my contact, or if not, we'll see how we can get it passed through you. It's pnet@oai.int. I also added the sources if you want to learn more about how to understand the social media. Here you have the links. Thank you very much.
Thank you very much indeed, Paula. I have to say I'm very grateful, especially to both Taylor and Paula, because they're very busy currently preparing for World Rabies Day, which is coming up before World Antimicrobial Awareness Week. So knowing that we need a little bit of lead-in time, it's been very useful to hear how the planning process can go on. So Paula, if you could just stop sharing your screen for a second. Thank you very much. So I have a task now for our participants. I'm very pleased to see that almost all of you are still there, which is amazing. Thank you for bearing with this. I know it's a lot of information to take in, but my task is we're very interested to know what you're planning. So from our little poll at the start of the webinar, we asked you if you already had some activities planned for World Antimicrobial Awareness Week. So if you're planning something, could you maybe just pop a little note in the chat box so that we can get an idea of the kind of activities that people are planning? I think that's maybe the quickest way for us to do it. And if I just, if I share and just show you a quick reminder of the kinds of things that we've been doing. Let me see, I'll find my, okay, share. Okay, so we're talking mostly about virtual events. So we've heard a lot today about social media, different types of platforms that we can use. Obviously, that's using awareness materials, but also if you are planning some other virtual activities like some webinars or virtual meeting, then that's also an option. Physical events, if I think some members are planning some smaller face-to-face meetings. It would be useful if they could let us know. again, Taylor gave us a very comprehensive overview of all the OIE awareness materials that you're free to download, to have translated, to print, and to share by whichever means you think is best. And other topics, I just maybe want to highlight that there are many different options, but it is useful if you can think about the stakeholders that you're targeting for your message, and then maybe try to do some sort of assessment for what's going on afterwards. Just a little bit of quick news. So we are currently developing a new web page on the regional website for good practices. So I noticed that Kinsling has put a comment in the chat box. We're looking for success stories of things that have worked within your area, so that we can maybe learn from each other some more. If you could get in touch with us, as I say, we're currently developing the web page, and hopefully that will go live in a few weeks, but we can add more stories to that as we get them. And also, please do let us know. So Paul obviously has said she's very open to receiving requests for information. I'm sure Taylor as well, but from the region, if you let us know if you have some proposals that you need, maybe some technical support, or we probably have some financial support that we can offer as well, similar to last year. So we'll be sending out an invitation for some proposals to delegates in the next few days. So just follow up on that. And I think now it just